This video guide outlines the proper steps for performing an injection with the BD SafetyGlide insulin syringe with 6mm needle and includes helpful injection tips for frequently asked questions. BD SafetyGlide insulin syringe with 6mm needle currently offers a high level of protection for healthcare workers and patients with a 6mm 31-gauge needle designed for safe, less painful injections when compared to longer and thicker standard insulin syringes, providing lower risk of needle stick injuries for healthcare workers and lower risk of intramuscular injection for patients. And one-handed activation of the safety mechanism to help prevent needle stick injury. BD SafetyGlide insulin syringe with 6mm needle, available in 1 milliliter, half milliliter, and 3/10 milliliter barrel capacities. Performing an injection with the BD SafetyGlide insulin syringe with 6mm needle. First, confirm that you have the correct type of insulin and check its expiry date. Then, verify the patient identifiers. Choose a healthy injection site. The recommended areas are the abdomen, thigh, back of arms, and buttocks. Be sure to rotate between and within injection areas, and that injections are always a finger's width apart. When you have selected an appropriate site, cleanse the skin. When the patient is ready, you can prepare the insulin syringe for injection. Remove the orange safety cap and rotate the safety arm to make sure the unit scale is visible. Pull the insulin syringe plunger out to the desired number of units. You will need air in the insulin syringe equal to the amount of insulin you will take out. Next, place the insulin vial on a flat surface and wipe the top with an alcohol swab. Puncture the center of the vial at 90 degrees to avoid needle damage. Then push the plunger down completely to inject the air into the vial. Turn the vial and insulin syringe upside down and draw the desired number of units of insulin into the insulin syringe. If your facility allows recapping a clean needle for medical transport, recap the needle using one of the following techniques. For a cap stand, stand the cap on a level surface, aim the needle into the center of the cap, aligning the safety arm with the slot on the cap. Then insert the insulin syringe until it snaps securely. You can also use a scoop technique. Place the flat part of the cap on a level surface, then aim the needle into the center of the cap and push the base of the cap onto the insulin syringe until it snaps securely. Now, administer the injection. When given by a third party, injections with a 6mm insulin syringe needle should not be given into a pinch-up. Press the plunger slowly and steadily until the full dose of insulin has been delivered. Once the injection is complete, point the insulin syringe away from yourself and others and activate the safety mechanism immediately. Use one finger to move the push rod completely forward until it is fully extended, the needle tip is covered, and you hear a click sound. Immediately dispose of the used insulin syringe in a sharps container. To help you and your patients have more successful injections with BD SafetyGlide insulin syringe with 6mm needle, we've collected a few helpful tips and answers to common questions. To avoid bends, be sure to penetrate the center of the insulin vial at 90 degrees. If you insert the needle on an angle, you can hit the sides of the stopper and cause a bend. It helps to keep the vial on a flat surface when inserting the needle. Don't hold or cradle the vial in your hand, as this increases the risk of a needle stick injury. Always watch to make sure you're inserting the needle correctly. Recent recommendations suggest that, when given by a third party, injections with a 6mm insulin syringe needle should not be given into a pinch-up. This reduces the risk of needle stick injury to the healthcare provider. You can inject straight in at a 90-degree angle to the skin. However, some patients may require a pinch-up injection. For these patients, it's recommended to reduce your risk of needle stick injury by keeping your thumb and finger 1 inch apart and injecting into the center of the pinch-up. Alternatively, you could inject at a site with more subcutaneous tissue where no pinch-up would be required. For more information about BD SafetyGlide insulin syringes with 6mm needle, visit bd.com/diabetes or call BD Customer Care at 1-888-367-9539.